The congregation actually had its beginnings in mid-17th century France, when 6 women came together to support one another in living a life dedicated to God and the dear neighbor. In the late 1700s, France was in the grips of the Revolution. Since the sisters would not sign the oath renouncing their faith, convents were closed, properties confiscated, and most of them dispersed. Many, however, were gathered up, cast into the dungeons, and 5 were guillotined. Among those imprisoned was Sister St. John Fontbonne, who, along with a number of other sisters, had been sentenced to death. The night before this was to take place, Robespierre was defeated, the revolution ended, and those in prison were released. The sisters' reputation quickly spread. There were many poor and destitute people, and the services of the sisters were needed.
I never thought about being a sister. They were at school when I got there in the morning, and they were there when I left at night. And I never thought that you ever became a sister. I mean, they were just there, and that was that.
I think I knew I wanted to be a sister from a very young age, and it was something that I could not do. I had felt this calling from God to be of service. I just wanted to respond out of that.
I always wanted to be one of the sisters, as long as I can remember. The sisters used to come up into the country, and they'd come up and beg for the orphans. So I really got to know the work of the sisters and to understand some of the wonderful things they did.
If you go back to those first sisters and look at what characterized not only them, but each successive administration, you find a couple of points. You find people of great courage, people of great vision, and people who were not afraid to look at the times in which they live and say, what is it that we need to do?
Women in general in our society were not in leadership roles, and here are these women who single-handedly built one of the largest healthcare organizations in Ontario.
After the fall of Robespierre and the French Revolution, when the congregation came back together, there was a new set of needs. And when they came to Hamilton, there was a new set of needs. An epidemic, typhus and cholera.
There were a lot of immigrants at that time, and so the cholera spread very quickly.
And so the sisters volunteered, really, to take care of them.
And so you can see today the sheds where the people were condemned to stay until they were better or until they died.
And you have to remember, in those days, there was no public health system, there were no public hospitals, that it was religious orders and orders who cared for people out of volunteerism, not a state-organized healthcare system. So the sisters really began the healthcare system in Hamilton in an organized way.
In 1861, Mother Martha and 2 of her companions made a 2.5-hour train journey to Guelph with precisely 50 cents in their pockets. And that's how St. Joseph's in Guelph was born.
And gradually, they were invited to come to different places to open hospitals, to formalize taking care of the sick in different communities.
These were women of grit. They were women of courage and commitment and clarity. Clarity about what they were about, taking care of residents and patients and participants and putting them first.
As healthcare became more complex, and we needed to build up our institutions so that they worked even more than they had in the past. We saw that we needed to create something whereby we could hand on to others the mission and legacy of the sisters.
I'd say the group today that has picked up that mission and run with it in a remarkable way, while everyone at St. Joe's contributes to that, at the front line, it's our nursing team.
The nurses and the staff of our institutions are fantastic. They work hard, they're great men and women, and they are very dedicated.
Being called at 3 o'clock in the morning to please come to work. The patients needed me, my peers, my colleagues needed help. Could I please come to work? And I did.
I would strongly advise one to never compromise their values or integrity, to continue with the warm, wonderful, compassionate care that the nurses provide in the community.
Because I'm not a nurse, but they're at it and they're there with that willing spirit to help.
What you want to do is to have good stories that people can look at, relate to, understand, and try to emulate.
Early in my career, I had a physician who was elderly and he was very sick and he required some very expensive medication. And he wondered if there was any possibility that I might go and see if the hospital would consider giving him this medication free. And Sister Paula was the administrator of the hospital at that time, and I went down to her office, explained the setup to her, and she said she didn't listen anymore, and she just picked up the phone, called the pharmacy department, and said, Dr. Sale will be down in 10 minutes for some immune globin, and I want you to give it to him, whatever he asks, and replenish the supply whenever he comes back. End of conversation. And that man was kept alive with that immune globin for years.
There's so much history here about the Sisters' legacy, and I think that's very special to St. Joseph's because it's very unique. It's not something that can be replicated, and the history makes staff feel very proud to work here.
When I think about the way in which people work together here to minister multidisciplinary, holistic care, and the way we work as a team, the culture of St. Joseph's Healthcare really shines through.
Just care for the residents. Do your ultimate best. Not only doing your work, but doing it with compassion and love.
There's a very caring staff here, and I think that it's reflected in the quality of the care they give.
And so with my experience, I'm giving others the benefit that I received. So it's my turn now to pay back the villa, and I'm doing it.
I think we're all filled with tremendous pride when we go through the hallways at each one of our sites and see the incredible amount of improvements that the foundations have brought to life. Whether it's the resurrection of an entirely new building, a capital project, the purchase of much needed medical equipment, the funding of research and academics, or programs and services to help enhance those whom we're privileged to serve. The foundation plays an integral role in all of that, and we couldn't do it without the spirit and the compassion of the Sisters of St. Joseph guiding us and guiding each community that we serve.
As you look at the developing world, you see needs abundant. You see currently the crises in Darfur, the Middle East, Iraq, Iran.
Effort in Haiti is phenomenal in that it's a country that has great potential and that has great spiritual values, but who has had the misfortune of being mistreated socially and politically. A 22-year-old lady who had just giving birth to a child by cesarean section and was dead on the table, and we discovered there was a lack of oxygen. So what we did, we came back here with this and made it a project and donated to that place a system that could manufacture oxygen on site. From that moment on, we know that we have reduced the mortality rate from 30% to 10%, and that's remarkable, and this is evolving.
People are exquisitely grateful for what you bring in equipment, but they're most grateful for the fact that you bring yourself and your care and your interest. And that takes us back to our mission, because that's what we're all about. We're about preaching the Word of God in service to others.
They were always, right from the very beginning, they were known as being very competent, capable, offering compassionate, sensitive care to everybody who came to them for healthcare assistance. It didn't matter what creed, religion that they were. Everybody was welcomed to our doors. And that is part of our legacy that we want to be able to continue.
Working in healthcare, really working in any large organization today is not easy. It is full of challenges. But I think also to understand that with the challenge come the blessing and the graces to be able to do what is asked.
And I think the legacy of the Sisters of St. Joe's can continue by keeping the same type of staff that they have right now, with kind, caring hearts. I think that's the way their legacy carries on.
The legacy of the sisters is to perdure in health care. It has to be a legacy of reflection, vision, courage, and creativity.
Because of the sisters and the mission work and legacy that they have created, each one of our facilities has come to life. Each one of our institutions is brimming with wonderful programs and services that helps the community. On behalf of all of the patients, the staff, and the volunteers, we owe a tremendous amount of thanks to each and every one of the Sisters of St. Joseph for believing in us and for allowing us and giving us the privilege to continue their mission in all that we do, not only for our generation, but for future generations to come.
Knowing the legacy of the Sisters of St. Joseph's means for most of us who work here that we're called with a higher purpose to do the best we can, looking after the patients and the families that come into this institution. And I'm very proud to work here.